next we are starting with. So before that, I want to say from where am I reading this? I'm reading this from the official neet PT syllabus. They have got a perfect syllabus, isn't so? So from that, I'm just reading what all is important. Okay. So you all know that standard books for internal medicine is always Harrison. And also I will tell you will to study electrolyte, then endocrine, renal, then study CNS. CNS is very important. CNS at the same time is actually very easy if you learn in a wise strict manner. CNS, when you're planning to start CNS, just start with meningitis because this meningitis is going to be very, very important. That table, voila. In 2023, they have asked cobweb appearance. Where do you see? Most of them will not be knowing it's in TB. So one of the very, very important questions. So many printouts and pictures in the textbook is there. So it's very important. So just study meningitis, how to differentiate viral, how to differentiate fungal. That's what are very important. Then come to headache. Headache, voila, that's sunken, like SUNCT, cluster headache, how you differentiate and what is the treatment. Okay, where do you give this thing? How is the treatment, voila? Just look it. There is a simple table is there. Just learn it. And about meningitis is going to be very important. At the same time, Parkinsonism is very important. Parkinsonism, multiple sclerosis, amyotrophic lateral sclerosis, that is very, very important. Then Parkinsonism and this Parkinson, that definition, just read it. CNS is very, very important, as well as when you compare the 2023 question, there were so many questions regarding this integrated with HIV. In HIV patients and like TB patients, how like CNS, what about the brain images, they correlate with this infectious. So very important, just learn HIV also. We can expect this time they will again shoot up with this HIV and all those things. So just read it. Then intracranial space occupying that, so just read it and go. Yeah, epilepsy. I'm predicting that this time there will be definitely a question from epilepsy. We can expect for epilepsy. Like means seizure. Seizure where this actually they can integrate with pediatrics. Pediatric, that ACTH where you give it, there is tuberous sclerosis, what happened. And with the drugs they can ask. Okay. Cluster headache. Just read what there is a big table now. Just read with how types of all those headaches and all. Okay, so again, yeah, stroke wala, if you feel like stroke is very difficult, in like just read that stroke management, there is certain criteria. When do you do thrombolysis, when you doesn't do like PCI, all those things, just read it. And also at the same time, just read like what happens in Weber's syndrome, LMS. So many questions they will be framing to find out the answer will be LMS. So just find out what are the features in the LMS and Weber's syndrome, posterior voila. Think, PZA. That's all. There are so many tables are there. Just read it and go. Okay. Yeah. That's all. That's all. Then comes to, yeah. The other one scoring subject is rheumatology. Rheumatology is also very easy subject. Sorry, easy chapter actually. You can give SLE, you can study. Vascularity is very important. Sarcoidosis, ankylosing spondylitis. Ankylosing spondylitis, they always ask in point of orthopedics, they used to ask multiple times. Okay, sarcoidosis also. So scleroderma, sarcoidosis, there are certain features. We can expect a question this time. Rheumatoid arthritis, very important. That features, I think most of them will be known because you will be studying in medicine as well as in ortho everywhere. So here study that SLE voila. SLE in what happened, what is a marker in psychiatric SLE, there is certain things are there. ANA profile, what is a screening, there is a box. Okay, please read that. Where in psychiatry, what is that SLA, this thing, psychiatric feature comes, what is SLA, what is anti-ribosomal, there is a big table. Just read, very, very important. Vasculitis, they can integrate with pediatrics, HSP and all those things. Read with all tables. Then comes, yeah, pulmonology. Pulmonology very important. Respiratory is very important. That is, you can study cystic fibrosis. There was a question in 2022, obstructive sleep apnea. Okay, then bronchitis, just read and go. Pneumonia, that is, yeah, just read like atypical pneumonia, all those, just interstitial pneumonia. Very important is interstitial as well as non-interstitial. Don't skip it. Bronchial asthma, you will be knowing now. That X-ray findings, hyperinflammation and all those things. COPD, just read. COPD goals criteria, that is very important. Then very, very important is respiratory failure, like type 1, type 2, where it is seen what happened in PCO2 level, what happened in O2, PO2 level. There is also a big table, just learn it. Yeah, pleural effusion is very important. We can expect a question. That is, there is a ratio regarding to that serum LDH and plasma LDH. Please do read it. Pleural effusion is actually important. Where what else you can see in TB and all those things. Pneumothorax, just go and read. Spirometry, very, very, very important. In 2023-22, there was a question regarding spirometry because it's the examiner's favorite question. That chat, voila, how do you calculate? So when you start planning to learn respiratory, just first learn that spirometry wala, that graph, then only start. Okay. ABG analysis we have already explained. That's all. Then about infections, I want to say that when you're planning to learn infectious, very, very important. Pneumocystis jirovecii, very, very questions will be coming always. They integrate with microbiology. At the same time, dengue fever also very important. Last 2 years, when you check dengue's questions being a little bit less, we can expect it for now. Encephalitis, dengue encephalitis, just look at this thing. Dengue is actually very simple and easy. And pneumocystis jirovecii, I just already explained. And also, I want you all to learn HIV, AIDS, COVID. Just read it. Just read. Don't give that much importance. But COVID, I think the pandemic is over. But they can ask. You can also give importance to Nipah virus as the same time HIV and leprosy. Just read it. You can integrate with the community medicine wala, that leprosy thing. HIV, what all the features in the CNS when you analyze the 2023 paper, you can see that there are so many questions they have asked regarding this HIV wala. What are the CNS? Very, very important. So all my subscribers, I want to say that please give importance to AIDS, HIV, pneumocystis jirovecii, all those things. Aspergillosis, you will be knowing that. Nipah and all those things, just read and go. We can expect questions from Nipah. You will be knowing that bag thing, fruit bags, and what all things. Dengue fever, you all know. And yeah, this many. Did I miss any of this? Yeah, I missed GIT. GIT